Well, hello and welcome to another fireside chat. In this seminar, I'm going to be representing my 2017 talk to the Association of Family and Conciliation Courts, the AFCC, at their national convention. And I went with Dorcy Pruter, and we jointly presented. I took the first part of the presentation and spoke about an attachment-based model of parental alienation, and you can hear that I did that representation of that in another fireside chat seminar. In this seminar, I'm going to be covering what we talked about relative to Dorcy Pruter's part, and so I participated in that. Dorcy and I co-presented on the High Road workshop, and I'll describe that as we go through the PowerPoint here. So this is the PowerPoint presentation to the 2017 National Convention of the Association of Family and Conciliation Courts, the AFCC, regarding Dorcy Pruter and the High Road workshop, what the protocol entails, how she accomplishes the recovery of the children, and sort of walks it through step by step what she does. And so I'll describe it all as we go through on this. There's a lot of current discussion and controversy surrounding these 4-day workshops, and they are different. So what Dorcy Pruter does is different than what Linda Gottlieb does in Turning Points, or what Sullivan and Deutsch did with Overcoming Barriers. Might be similar to Family Bridges. Dorcy and Randy Rand worked together in developing this approach. So what I describe relative to Ms. Pruter and the High Road workshop may also be applicable to a degree to Family Bridges, but I'll let them speak to their own workshop. So with just as a preface here relative to Ms. Pruter, I met her in 2014. She introduced herself. She came to my office, opened her computer, showed me what the protocol was. I understood how it worked pretty much immediately. It's not psychotherapy. She's doing something entirely different. Then I was invited to watch 4 days of the workshop. So I've done that. I've seen workshop from beginning to end, all 4 days of it, observed it. And then I've also received a client. I was a follow-up maintenance care therapist for a client after she recovered them with the High Road workshop. And that is our 2019 presentation to the American Psychological Association, is the presentation of that data, a single case ABA design outcome study of the High Road workshop. So, but this is the 2017 AFCC presentation. And part of the reason I accompanied Ms. Pruter to this, she's not likely to get an acceptance to the AFCC because she's not a doctor. She doesn't have a professional degree. But she has a workshop that will recover kids gently and effectively in 4 days. And so that kind of introducing Dorcy and the High Road workshop to the forensic psychologists, because they should be talking together. The forensic psychologist should be consulting with her, should be finding out what she does, and she should be working with them in developing solutions. But they don't talk to her. It's a tremendous amount of disrespect from the forensic psychologists. They're kind of full of themselves, and it's massively unprofessional what happens in the family courts over here. So with that, let's dive into Back to the Future, back to 2017 with Dr. Childress and Dorcy Pruter. And this is about 2/3 of the way through. This is the High Road protocol that we're now shifting into. It's a catalytic psychoeducational intervention. What does that mean? Well, this is my description of how the High Road basically functions. Is that the High Road workshop is a catalytic psychoeducational intervention. So it's not actually doing something directly. It's putting things into place close proximity to each other, and then things happen. So it's a catalytic, and it's psychoeducational. It's not using any approach from any form of psychotherapy. So it's not a form of analytic therapy or family systems therapy or humanistic therapy or cognitive behavioral therapy or it's not any form of psychotherapy. It's just psychoeducational. I'll describe that in a second. But it's involving a sequence of structured activities that restores the normal range functioning of the child's attachment system. So basically, as you see those little diagrams moving in a sequence, in the first intervention, that recovers part of the normal range attachment system. Then the second intervention recovers even more of it. The third intervention recovers more. The fourth intervention recovers almost the whole thing, leading to eventually, she starts out with that little, squirrely little child there, kind of all bumpy and damaged. And that with each intervention, that blue circle of healthy is getting larger and larger for the child, until finally we have the high road intervention recovers a healthy normal range child. But it's not actually doing anything. It's not going into the child. It's just moving the child through a set of sequence, a set of steps. So the high road workshop uses a series of catalytic activities. So the catalytic activities are two different forms, basically. One is psychoeducational content videos and narrative story videos. So the first category of the type of things that happen in the workshop are videos. Okay, so you can see like videos you grab from YouTube or like you see on a Saturday morning, TV show or Hallmark TV channel or something. They're just normal range video stories about various things. And they draw for things like empathy or compassion or prejudice, cognitive distortions, whatever it is. These video content is about content areas. That's where it's psychoeducational. And so there's one set of videos that are about content videos and narrative story videos. And then some things like educational videos off of YouTube and that sort of thing. Then the second type of activity is a structured problem solving and communication skill building activities. So that's just your normal. She breaks out, for example, she'll watch they'll watch a story narrative video about kids doing something and getting in trouble and having all sorts of problems because there's prejudice among the groups of kids getting involved and stuff. And so it's an actual story. Then they watch the story for like 15-20 minutes. And then she'll break out into a group and say, okay, so here are some words like prejudice. Here's what the definition is. And she shows them a definition and she says, can each one of you give me a definition of prejudice that occurred in that video segment that we just watched? So here you see she's getting a higher degree of cognitive processing of the material. And the type of material she's going for is cognitive perception, judgments. Are our judgments accurate? Where do we base them in? How do we make our judgments about things? She's not talking about the family. She's not talking about family relationships. She's not trying to fix things. She's not. In fact, she puts a moratorium on talking about the past. We're not going to talk about the past. And that's solution focused. So there's a principle behind that. So she's because trauma pulls for an unresolvable past. And if you go to the past, you'll never solve anything. We need to move it from now moving forward. And so if she helps them kind of reorganize. So other types of structured activities she might do are like that, having a little group thing where you make I statements and she teaches about problem solving and communication skills and stuff, just basic skill building activities. That's the entirety of the workshop, either watching videos or doing skill-based activities. Okay, there's no focused on the family, there's no psychotherapy, there's no doing anything. Okay, and in doing that, she just sets up a sequence of activities that ultimately restores the child's healthy attachment bonding. So here's your standard psychotherapy. So here's how the situation we are currently approaching it, or this would be the model of how we would think about approaching it. It's not currently happening, but we have the diagnosis of child psychological abuse, and then you see the child up there is with the father, and the child's all kind of distorted and damaged with the father, and there's an emotional cutoff relationship with the mother up in that top diagram. That's the psychological child abuse. So the mental health professional diagnoses the child abuse, and the court gets orders of protective separation based on the child abuse diagnosis by a mental health professional. Okay, let me be real clear on this. If there is no child abuse diagnosis, then there is no justification for protectively separating the child, because there's no need to protect the child from the parent. If we need to protectively separate a child, there's a need to protect the child, which means there's a child abuse diagnosis that corresponds to it. Okay, so that's where everybody's getting into problems with these 4-day workshops, with just with everything, with what the treatment programs and everything about this pathology is you're going to treatment before you get a diagnosis. Are you treating cancer or diabetes? What are you treating? Diagnosis comes first, and the relevant diagnosis is child psychological abuse. What's the treatment for child abuse? To protect the child. We protectively separate the child from abusive parent. That we do that with physical abuse, sexual abuse, neglect abuse, and psychological abuse. 4 types. We always protect the child. So let's be real clear on the justification for the child protective separation from a parent. It's because of a diagnosis made by a mental health professional of child psychological abuse, shared delusional disorder, factitious disorder imposed on the child. If you don't have a child abuse diagnosis, then there's no justification for separating a child from a parent. That's inducing attachment pathology. Separating a child from a parent is inducing pathology, bad pathology. The only reason we would do that is because leaving the child with that parent presents more of a risk to the child, creates more damage to the child than separating the child with. Okay. And that's a child abuse diagnosis. So I want to be clear on that. So now, the first step, we got the child abuse diagnosis. We separate the child. Now that's your second image, where the child is with the mother, but they're not bonded yet. They're just kind of in the same environment. And you see the dad over there is being protectively separated from the child. The third phase of that is the family therapist comes in and helps the child get rid of the bumpiness and get rid of the damage, and restores a normal range child and a normal range bond with the mother, still protectively separating the child from the father's negative influence. And so let me explain that really clearly. If we're trying to do therapy, so we have 2 parents and the child, and if we're trying to do therapy to restore the child's attachment bond to one parent, and we have the other parent who's trying to make the child pathological still, and as we're trying to make the child healthy, we're just going to rip the child apart between the motivations of the pathological parent for the child to be loyal and be symptomatic, and the intentions and motivations of the treatment team and the targeted parent to rebond. And so we're going to rip them. So for the treatment period of the recovery, we need to separate the negative influence of the pathological parent from the child, so that we can restore the healthy development of the child without this pathological parent continuing to produce pathology in the child. That's the purpose of a protective separation from a psychologically abusive parent. Okay, so that's the third phase here, is once we get the protective separation, we get the family therapist on that to restore the child's healthy development and the child's healthy attachment bond to the mother in this case. And my estimate for that from psychotherapy, my psychotherapy approaches can recover a healthy attachment bond between probably 3 to 6 months, as I'd give it, 3 to 6 months to do that. Then once we have the child's healthy development recovered, then we restore a normal, that's the final picture, the normal healthy range separated family structure of child bonding to both parents. We put a therapist on the spousal conflict to keep that relatively in check. So that final picture of the kind of healthy separated family structure is our goal. Now, what Dorcy does and what the high road does is that it's an intervention on that first protective phase. So you see a normal therapy, the child's just sitting there all alone in kind of no bond to mom, but the dad separated from dad. In the high road phase, the child immediately goes into this 4-day workshop that gets the child support. And at the end of 4 days, Dorcy has recovered the healthy attachment bond of the child. So that by the time we enter the third part with the therapist, where I was involved in that, I was a therapist in this case. Well, we enter the third part, the child's already recovered. Now, if you look at the previous one, the therapist has to recover the child from being damaged to healthy and recover that attachment bond. But after the high road, the therapist's job is easy peasy. They just have to stabilize the child because the child's already recovered. And we still maintain a protective separation to get the stability of that because it's really fragile. It's been 4 days and all of a sudden it's recovered. And so we want to give it a little bit of time to stabilize that healthy attachment bond. And then we move to the final one. So, and I would estimate on this, if you use a high road to augment the protective separation to start it, I would guess we could potentially end the protective separation at 6 weeks, 6 to 12 weeks. So I've got, 3 to 6 months with psychotherapy. I'm going to need a protective separation. I'm going to need a month and a half to 3 months, much shorter with the high road because I've already starting with a recovered child. Okay, so that's the benefit of using a high road augmented recovery. And the issue, again, to realize is that the high road is not a treatment. It's just a 4-day workshop that then moves over to the therapist. So we still need the therapists on the back end of that doing the maintenance care therapy with the recovered children and understanding what the pathology is and how to deal with that. Contingent visitation schedule would work well during that period. So let's talk about the actual high road protocol, what it actually is and does. So here's the attachment system. Here's my representation of what the attachment system is kind of like. So we have an overarching attachment system, but it's resting within a nest of other brain networks, neurological networks. So up on top, we have the affectional networks, the warmth, loving, bonding kind of networks. Then over on the side over there, we have the empathy networks. So those are understanding of others' feelings, and then on the other side is the compassion networks, caring about other people. And so the compassion, empathy, and affection networks all kind of then contain this motivational network to bond to the parent and get protection from predators. Now, what happens is with this pathology, that attachment system is entirely turned off. The motivation to bond to the parent is turned off. The affection networks are turned off. The empathy networks are turned off. We see cruelty. The compassion networks are turned off. And so both the attachment system and its entire context are turned off by this pathology. In addition, we have these emotions off of this. So the grief comes from the breached attachment bond, and then the pathological parent twists the grief into anger. So we have intense levels of grief at loss and intense levels of anger related to that sadness and the misattribution of that sadness. And so this is basically what we're looking at in terms of the attachment system starting with, is we have a completely shut down attachment system, a completely shut down context for it in the brain networks. And it's producing this massive grief response from the shutdown attachment networks that is then being mistranslated into anger through the influence of the pathological parent, which then shuts down the attachment system, the anger does, which causes the grief, which causes the anger, which shuts down the attachment. And so you get this cyclical kind of shutdown of the attachment bonding motivations. So that's what the attachment system looks like when it arrives at Dorcy's. Okay, when it arrives at the High Road workshop, this is what the attachment system looks like. And so this is what Dorcy does. She starts by intervening. So let's say she starts with an intervention on empathy. Okay, and that's the one she starts with is high empathy video. It's a story video. And so she intervenes on empathy. They watch a story and it just opens up, understanding for other people in other situations. And as a response to that, the child's empathy system starts to glow warm. Now, they're not talking about the past and they're not talking about, problems or the relationship or anything. They just watched a video. That's all they did. They watched a video, story video, and empathy networks are glowing because the video activates empathy. Okay. The next thing she does, show them another video that activates compassion. Okay, where you just care about the people and you care about the situation. And so again, it's just a content video. You're not doing anything about the family. You're just watching a story like you might watch on, TV or something. And so now you got in the child's brain, you've got their empathy and compassion networks active and kind of glowing just simply because of the media they're watching. That's why it's psychoeducational. It's not any therapy kind of stuff. Then she breaks out, let's say, into a structured activity, talking stick or problem-solving activity, making I statements, something like that. And so now what's happening is there's no reason for the child to be angry in this situation. Okay? There's no cue for the angry. There's no harm. There's nothing going on. And the child is kind of emotionally exhausting down. You can only stay emotionally charged for a period of time. And so they come in all grumpy and angry and stuff and shut down. But after a while, they just start, and you're sitting next to the other parent and the angry just disappears because it just kind of wears out. And so now we've got the child in a situation where they're not actively angry, and we have their empathy and compassion networks are glowing. Now, notice this attachment system's still off. We still don't have a motivation to bond to the parent. So then the next activity she does is up on the affectional networks. Now, when I saw this, let me pull this up for a second. When I observed her session, her intervention on the affection networks was the beginning of the second day. And there were some videos, about 2 or 3 videos she showed that where, for example, a guy, was a researcher with gorillas and spent a lot of time, years over, working with this one particular gorilla troop. They hadn't seen him for years. And then this video segment is about him going back to revisit these gorillas that he spent so much time with. And oh my goodness, it was so heartwarming. The gorillas were so happy to see him. And it was like touching and brings a tear to your eye about just love and compassion and how these gorillas loved him and he loved them. And there was a couple of them like that just real tear jerkers of happy love bonding stuff. And so that happened about the beginning of the second day. And so the empathy and compassion networks were and getting off the anger was day one. And now look what happens. Okay, so somewhere about the middle of the second day, she's got all the context networks glowing warm. They haven't talked about anything involved in the family. It's just watching videos. She's got all the background brain networks glowing, active from they're watching the videos. And the child's no longer angry, getting a suppression on the attachment networks. So guess what happens? The child's sitting next to the targeted parent. Boop. Primary motivational system of the brain. Motivational systems always have direction. This is a fundamental motivational system like eating or sex or hunger, pain. And so you put the child in a situation, you remove the anger that's inhibiting it, you take them out of the conflict with the other parent, and you activate all the surroundings. And the attachment system activates it. So typically you get bonding back, hugs, and crying about somewhere second day, maybe third day, but somewhere about the second day, you'll get the attachment system will activate. The moment the attachment system reactivates and rebonds, the grief goes away. I mean, now your grief is gone. And the moment the grief goes away, the anger goes away. There you go. There's your healthy attachment system. And she never talked about the family. She never talked about the family conflict. She never did anything. Just watch these videos, do these activities with me, and we'll fix the problem. And sure enough, that's what happens about the second day. Third day and fourth day is helping the family prepare for reentry into the world. But then she needs a therapist to catch this. She's given you a healthy child. Now she needs a therapist to do the family therapy for ever and ever, because you got a narcissistic, borderline, dark personality out there. The moment you restore contact, child psychological abuse is going to happen again. My recommendation is a contingent visitation schedule. You follow the high road with a contingent visitation schedule for the family therapy, and I think those two would do well, very well, in solving the pathology when the court needs that. All of it predicated on the child abuse diagnosis. Get the child psychological abuse diagnosis, toss a high road workshop on it, toss a continued visitation schedule, and I think you'll solve the problem. So the next thing I discussed about the protocol, this is the protocol. Okay, so when people talk about what the high road protocol is, the protocol entails the intervention she uses. So, for example, there's empathy intervention. She might have a narrative story video would be one empathy intervention. She'd have a second narrative story video that could be a second empathy intervention. And maybe a workshop activity that would also focus on activating the empathy networks. So she can use multiple media to reach the same kind of goals relative to the networks, or critical thinking intervention. She has, again, videos she could use for that, or maybe workshop activities, maybe an informational video off of the internet about, perception and how we make judgments. So what the protocol actually is just the structure of what videos she has available, what activities she does, and kind of the order in which she does them. But then also she can read the room as she's doing it. And so she might say, I need a little bit more empathy. So she might double up on a couple of empathy interventions before moving on to a compassion or moving on to a cognitive perceptual kind of thing. So, and so there's a bit of art to the craft of what she does, but it's pretty straightforward. And so this could be done by a paraprofessional. It does not need a psychologist level to run this. It just needs a paraprofessional. The high road protocol represents the specific component videos and structured workshop activities used and the sequence in which those catalytic interventions are applied. Both the component content and the sequence in which the supporting underlying brain systems are restored are critical to the successful application of the catalytic interventions. So it's both what are you targeting and then the sequence of how you target them. Okay, is how the catalytic situation. If you put the catalysts in the wrong place, they're not working on the right stuff yet. Okay, so you work it in a sequence of opening up the attack. That's why I would suggest Dorcy's the most experienced professional doing this. She knows this extraordinarily well. And so the psychology people need to get over to her, talking to her about what she does and learning about how she does it, so that we can start to do it too, or start to train our paraprofessionals to do it as well. And that's part of the reason I went to the AFCC with her, is to make that connection, to introduce, Miss Pruter, clinical psychologist or forensic psychologist, Miss Pruter. But they didn't do anything. And that's the problem over here. So you have something like Deutsch and Sullivan's Overcoming Barriers. They didn't consult with Dorcy. They didn't talk with her. And now Overcoming Barriers is a complete failure. Okay, which raises ethical concerns that they're charging money and taking court cases and stuff for something that's a complete failure. And also indicates that the forensic psychologists don't know how to fix it. If they tried to fix it, then it's a complete failure, Overcoming Barriers. But even as it's failing, they never consulted with Dorcy Pruter. Now, I've worked major projects, and if I'm on a project like that, I get some consulting funding and go hire Dorcy as a consultant on, at least especially if it's failing. Get and find out what she's doing. But there's such disrespect. Let me take a second on that aspect of Dorcy and the disrespect she gets here. Dorcy Pruter could get a doctorate degree easy peasy. Are you kidding me? You think about what it takes for the major issue for doctorate is a dissertation. Going to courses and taking tests, that's easy. Okay, that's just content information. She's got most of the content already on psychology. So it's really the dissertation that's the hurdle. So let's look at her dissertations over her career. The high road is one. Holy cow, that's like 100 times more sophisticated than any doctoral dissertation. She's created a 4-day workshop intervention for narcissistic borderline dark personality, psychological abuse of children. Yikes, the most severe, difficult pathology to work with, and she's got a 4-day recovery workshop working in the family courts where everybody's fighting. That's amazing dissertation work. So that blows it off. And then something like the custody resolution method, a qualitative research project using for content analysis using data coding. That's standard research methodology. And she's not only conducted like a dissertation research on it, she's created a full research lab. Oh my goodness. Okay, so she could doctoral dissertation, easy peasy. And I think she should do it at this point. I think just given all the Caden's law and everything, I think she should just go back and get a doctorate degree, get her dissertation off of the CRM, and she doesn't even need to be a clinical doctor. She just go get a research PhD research doctor because she's got a research lab, custody resolution method. Boom, become a doctor, fool everybody. The whole pathogen's attacking Dorcy Pruter. She only has high school education. Boom, she can get a doctorate degree. It doesn't matter to me. Okay, her professional qualifications have met my bar for respect. Okay, so, and I think her work has met the bar for broad professional respect. And that's why I accompanied her to the AFCC convention, okay, is because we should be learning what she's doing and doing stuff. So the catalytic interventions of Dorcy Pruter, the High Road Workshop, is an entirely different type of change agent approach than is used in any form of traditional psychotherapy. And so that's why if we ban these 4-day workshops, we're banning something. First off, they're banning something they don't understand, and we're going to be get rid of something that has utility across a number of trauma pathologies. If we adapt it, this approach, this sequential catalytic approach to change has application to substance abuse, prison recidivism, right off the top. Those are the two I would look to adapt it to on this trauma. And you just open up the series of brain networks in the attachment networks on a particular sequence relative to the difficulties that led to the substance abuse or the prison situation. And you fix the kind of attachment networks on those. And I think you can actually do that. So legislatures, if you're banning all 4-day workshops without understanding what you're banning, you could be banning something that is highly effective with trauma and child abuse and a lot of stuff just because you're ignorant. Lack knowledge or information. If you want to know what Dorcy does, go talk to Dorcy. But if you're banning stuff without knowing what it is, you're ignorant. That's just the definition of the English language. So, the implications of the catalytic intervention approach employed by the High Road Protocol for broader professional psychology extend to interventions with other forms of pathology such as substance abuse, prison incarceration and recidivism, and recovery from complex trauma experiences. The catalytic approach of the High Road Protocol restores normal range attachment bonding motivations, but doesn't focus directly on the attachment system or the parent-child bond. The catalytic approach of the High Road Protocol restores positive and healthy family relationships, but doesn't directly focus on the relationship itself or its problems. The catalytic approach of the High Road Protocol is simply a sequence of steps using videos and workshop activities that restores the normal range functioning of component brain systems for compassion, empathy, affection, and critical thinking. The restoration of the normal range functioning of these component brain systems allows for the resumption of the normal range functioning of the attachment system, and the normal range attachment bonding motivations resume. So let me talk for a second about just, I don't have any relationship with Dorcy, no business relationship, nothing going on. There's, since the Oregon licensing board said I'm not allowed to consult with her, provide any consultation to Dorcy Pruter for some reason. So I'm not providing any consulting to her. So I have no contact with her. My recommendation, though, what we faced in 2017 is that if Dorcy describes what she does, describes the protocol, what videos exactly they watch, in what sequence, the activities she does, if she discloses her protocol, other people are going to steal it. That's her intellectual property. Okay, that's her business. And so if she tells people what the secret recipe for Coca-Cola is, other people are going to start making Coca-Cola. Okay. So she keeps that as a business confidence, her intellectual property rights on that. So I'm not disclosing what exactly the videos are or what exactly the workshop activities are, but I have seen them all. I know what they all are, and I am vouching for them. Okay, they're just innocuous kind of stuff. And if you saw what they were, you just go, oh, really? Is that it? And I will just point out, though, look what's happened so far. Dorcy Pruter has a 4-day workshop. Linda Gottlieb tries to ape it. She has her own 4-day workshop that she just developed based on her own imaginings from parental alienation syndrome. Now, if Dorcy had disclosed what her protocol, do you don't think Linda Gottlieb would have just started grabbing that and trying to do it and say, oh, I'm doing it, and it would have failed, and then Dorcy gets hit with, well, your method doesn't work because Linda Gottlieb tried it and it failed. Okay, so Dorcy doesn't disclose her protocol. You don't think that, look what happened with the forensic psychologists. When they were developing their 4-day workshop, did they come talk with Dorcy, consult with Dorcy, collaborate with Dorcy? No. They tried to come up with their own competing model out of forensic psychology and psychotherapy. Complete failure. Psychotherapy will not recover these children in 4 days. That's why it didn't work. I could tell them it was not going to work. It's a psychotherapy. If you're coming at it from psychotherapy, there's no 4-day psychotherapy approach for anything. Not anything. On ADHD, autism, eating disorder. No 4-day workshop intervention for anything. So it's not psychotherapy. So go talk to her and learn what she's doing. Go talk to Randy Rand. She worked with Randy Rand, a forensic psychologist, Sullivan Deutsch. Go talk to Randy Rand, find out what he's doing on his Family Bridges workshop. But they don't. So I think there's clear evidence that the professional field of psychology in the family courts is absolutely abysmal in terms of the professional quality of practice, of professionalism, They are predatory. They'll steal your stuff. They don't give you citation credit. They grab stuff. It's just awful. The forensic psychologists over here are just awful. And then the PAS people are just fringe, kind of crazy people off on their own. So the level of professional psychology is really bad over here. Just look. Where am I? You look at my knowledge, you look at my background, you look at my expertise, and how do I respond to Dorcy Pruter relative to look at the forensic psychologists and how they respond? Night and day on our professional responses. In my view, that gives you an indication of who they are and the caliber of people they are. So, but at this point in time, I would suggest to Dorcy that she just disclose a protocol, that she just disclose what she does, the order what she does with the videos that she does and everything else. Because with Caden's law coming through, I don't think anybody else is going to get any traction with a 4-day workshop in the family courts. Okay. She has the only hope out there of doing it because she's solid. She's real. She's got data. She's got, the single case ABA that was presented to the American Psychological Association. She's got AFCC presentation. She's a real deal. So it's solid, and she's been here for 15 years, recovering children, hundreds of kids, got the data. So I think she could fight this. Once she discloses the protocol, then she's going to get a lot of predatory people kind of going on that. But I think she's actually capable of transforming out of the family courts at this point. And so I'm not sure there's much value in the high road for her as long as it stays on this particular course. And so mixing things up and giving out the protocol. And then I think that would get her back into the courts, because the courts can look and see and say this is like ridiculous, and the legislatures can look and see and say this is like ridiculous, and everybody calm down. The high road isn't something awful or bad. It's very straightforward. And so this pathology hides. It's a pathology of secrets, and in keeping her intellectual property rights, because it's her business, that's an element of secrecy that's going to be problematic going forward. And so I think, given the situation, my recommendation ultimately is to do a pilot program for the family courts, to develop the diagnostic assessment protocol and the treatment protocol from the mental health people. And so we can develop our diagnostic assessment protocol and our treatment protocol. And then right in the middle of that, when you get a child abuse diagnosis and you go into treatment, drop in the high road. You do 10 high roads, 10 subjects in your research design. You do 10 high roads. Researchers do 5 of them. Dorcy trains the researchers, and she does 5 of them. And then you can look at the differences. You can look at the situation. And in training the 5, she passes the protocol into the research and healthcare field. So I think that's the best approach to doing this. But who knows? Psychology is so abysmal over here. The forensic psychologists are disabling the mental health system response to the pathology. So the moment we clear out the forensic psychologists, we'll get an active mental health response that will solve things. So then at the AFCC convention, the next phase after I described everything is we went into describing what she does. So here's the first intervention. So we walked them through the first 5 or 6 things that she does at the workshop. So the first thing she does is reads the court order. And so Dorcy came up and told the people at the AFCC convention what she does. Okay, she says, I read the court order and blah, 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 and this is what she does. Then I got up and told them the benefits of that, what is actually occurring. So that when she does that, when she reads the court orders to them, that reestablishes appropriate hierarchy. She's in charge of the situation. And by reestablishing an appropriate hierarchy, that disempowers the over-empowered child. The child is thereby released from being in the middle of the spousal conflict and from the loyalties. The child no longer has to be strong and be the, rejecting. You're not in charge. The court's in charge. Dorcy's in charge. You can just relax and be a kid. And so this provides a communication of safety and stress relief. that, the adults are going to take care of you. You're 14 or 12 or something. You're not in charge of everything. You don't have to be strong. You don't have to. The adults have this. The court, Dorcy has this. Now the child drops out. When that happens, the next phase of things will be the emotional distress discharge. So she reads the court orders, and then the child starts to, I don't want to be here, and then we can't keep, then you can't force me this time. And it's, so typically about 30 to 45 minutes of protest behavior and challenging of authority. And so again, at 2017 APA or AFCC, Dorcy describes what she does at this point. And then I got up and described what happened, what that does. And so that emotional discharge is actually a testing of authority. So are you capable and competent, and can I trust you? Will you respect me? So all of that is a protest behavior challenge of Dorcy. So the first thing they do is say, if I'm acting out like this, what are you going to do? Are you capable of controlling me? Are you capable of keeping control of this? Or am I going to be able to dominate you and dominate this situation? Are you going to respect my difference from you? You want me to bond. I'm saying I don't want to bond. How are you going to respond to that? How? And so it's all these testing things that are going on. And then again, remember, I watched a 4-day workshop. So I've seen this in place. And so then once the child's test, the protest behavior represents an emotional discharge in response to the stress relief from being taken out of the middle of the spousal conflict. So yeah, the child, just gets there, and they're all stressed about going to this workshop, and they're afraid, and what are they going to do to me? And they come into this workshop, and they're all, and Dorcy says, the court orders and stuff, and they go, and they release the stress. And they're about 30, 45 minutes. And it exhausts itself. That's the way emotion systems do. They exhaust themselves if you just let them go. It's like a 4-year-old tantrum, basically. And by responding respectfully and with calm and confident authority, the facilitator communicates respect for the child's experience. And by responding respectfully with calm and confident authority, beginning trust develops. And so that was the most valuable thing, or the interesting thing to see about this early intervention part, is she's doing this and she's responding to these kids. I watched it, and they're brought in on adolescent transport. She's responding to their protest. It's building trust, because she's communicating to them both respect. Yes, I know you disagree. I'm not going to challenge your disagreement, but at the same time, this is what's going to happen. And I'm in charge, and the court's decided on this path, and this is where we're going to go. And that calm and confident authority, really combined with respect, really began to develop the trust in that already. And the second thing, just as the kids are screaming. And then the next phase is a question and answer. So after reading the court orders and getting through the protest period, she says, what are your questions? And she answers all the children's questions, all of them, honestly and forthrightly. And that's important, because the pathological parent, truth and reality is whatever I say they are. So, the sky needs to be red, I just say it's red. 10 minutes later, I need it to be yellow, I say it's yellow. So truth and reality are whatever I say them to be. That's the invalidating environment. So by answering the children's questions, honestly and forthrightly, she's just indicating, I will give you substance. Even if you don't like the answers, I will tell you the answers truthfully, and it's solid answers. So again, that's a trust building kind of thing. And it's just 3 interventions in at this point. So following the emotional discharge of stress relief from being released in the middle of the spousal conflict, answering all the child's questions honestly and without evasion builds trust and safety. The world of the narcissistic borderline personality is one of ever-changing reality defined by moment-to-moment needs of the narcissistic parent. Calmly and patiently answering all questions honestly and forthrightly builds trust and safety. So then the opening activity. The opening activity she typically starts with is a narrative video. It's just fantastic. It's a narrative story video fostering the vicarious activation of empathy and compassion. And the story examines issues of prejudice and judgment. And so Dorcy explained that to them. And then my commentary is that it's a wonderful and captivating opening video. It allows the child to recover emotionally. That's another important point. So this child comes in and they're all stressed out by the whole context of the situation, the family contact and everything. And so she gets there and they're really worried about what's going to happen. And so she reads the court orders and they protest and they kind of exhaust down. And now they're kind of exhausted, emotionally exhausted and everything. And they're kind of huddled down and defensive. And so now what's she going to do? Is she going to force them to interact with mom or dad or do something? What's she going to do? And I'm going to be resist. She shows them a video. Okay, it's about 20 minutes or 40 minutes. But it's a nice, engaging video, wonderfully engaging video. And so they're watching and they just get drawn out in the video. And it gives them a chance, kind of a darkish room to kind of reorganize their emotions. They're kind of exhausted, replenish their brain chemicals and watching this video. Okay. That's very respectful of them. And that communicates to them that she's going to be gentle. She's going to be respectful of where they are. So it begins the vicarious activation of attachment and compassion systems. There's no demand to interact with the targeted parent, and that's very stress relieving for the child. It addresses the child's anxiety about the workshop by demonstrating respect for the child's emotional exhaustion and triangulation, and it builds trust by demonstrating complex, authentic empathy for the child. The next activity is they go into a narrative story video fostering the vicarious activation of empathy and compassion. The story examines the issues of prejudice and judgment. So again, Dorcy is explaining this to what she does. This is Dorcy's slide where she gets up there and tells what she does. Now notice the second activity is the same as the first. Okay, kind of. They're two different videos, but they're in the same domains of content. And what that does is as I'm watching it, the child comes in stressed. And they're going, what? And they get this video, the first one, and they relax and they go, okay, so she's not going to force me to be with the other parent or that sort of. And then the video starts getting, and they get stressed again. Okay, now what's going to happen? And she shows them another video. And they don't have to do anything; they just get to watch. And it's in the same area. So she's activating empathy, she's activating compassion, but it's through the video. It's not with the parent. And it's just, and so now the child gets another video to relax in. Now, by the time that happens, by the time the second video ends, the child's kind of bored. They've watched two videos. It's been an hour here. They're supposed to be, what are we doing? Are we watching videos this whole time? I kind of I want to do something. And so she gets them set up for the third activity. So following up with the second narrative story video allows the child more time for emotional recovery, authentic empathy, and care for the child's well-being. Continuous vicarious activation of empathy and compassion continues the vicarious activation of the brain systems. There's no demand to interact with the targeted parent and addresses the child's anxiety about the workshop by demonstrating emotional or respect for the child's emotional exhaustion, and builds the trust again. By demonstrating complex, authentic empathy for the child. Third activity. Now she breaks out into the cognitive processing activity, gives them something to do, and then now they're talking about the second video. Show me, can everybody tell me an example of prejudice in that last video, something like that. So now they're active, and Michael, can you show me definition of prejudice? Okay, we're going to go around, and I want each person to tell me one example of prejudice that they've noticed from either of the stories that we just saw. Okay, something like that. That is the entirety of the High Road workshop. Okay. So you've gotten the introduction, and then she'll just bounce between watching videos and doing these workshop activities. They're not talking about the past. They're not doing anything. And she's just opening up the brain systems. And then somewhere in the second day, you get the bonding, the grief drops off, anger disappears. Now she needs a 90-day protective separation to give that mental health professional a chance to stabilize that relationship without the distorting influence of the psychologically abusive parent. All of this predicated on the mental health diagnosis of psychological child abuse. Right? But we need that diagnosis. We need the mental health people to do their jobs, to diagnose child abuse when the diagnosis is warranted. If they don't diagnose child abuse when child abuse diagnosis is warranted, children are going to be abused. And that's just a fact. So deepening the cognitive processing of the mental material by activating and applying cognitive critical thinking. Activating cognitive systems brings cognitive mediation to affective experiencing, turning off anger, cool thinking versus hot emotions. So you see, going back to turning off the anger, when you bring it into the thinking system, that turns off, it inhibits your emotions. Cool, hot. So she brings it up to cool, turns off the anger, gets the suppression off the attachment networks. So now she got empathy, compassion, pulls the anger off, activates the affection networks on day 2, and boop, up pops the normal range primary motivational system of the brain. So engaging in group activity normalizes interactions with the targeted parent that don't involve anger, judgment, or criticism. So you're not talking about the past, you're just doing normal kind of stuff, and places a child in proximity to the targeted parent without the suppressing effects of anger on the attachment bonding motivations, which will ultimately activate the child's normal range attachment. Now, the high road, then this is another Dorcy slide where she says 8 steps. And so she got up and described what her 8 steps are: remove the mindset obstacles, re-educate parents through co-parenting skill building, recover the authentic child, reestablish the attachment bond, restore normal range family interactions, reintegrate in the new family paradigm, rejoice and reward a family celebration, and post-workshop handoff to the maintenance care. Now, that is what the state legislatures are seeking to prevent parents and children from accessing. Do they understand that? Do they understand what they are preventing? Okay, by law. If they don't, I would say that's ignorant. Google ignorant, lack of knowledge or information. So these state legislatures are just making ignorant opinions based on fear. And so you got these biased people out of the family courts coming into their legislatures, sowing seeds of fear. Oh, these workshops are horrible and they're doing all these terrible things. No, they're not. That's a lie. That is an absolute lie. And so what they're trying to do is get Dorcy to expose their protocol so that they can then rob it and steal it and do it and trash it and destroy her business. But if she doesn't just expose her protocol, if she doesn't disclose the secret recipe for Kentucky Fried Chicken, then they're going to ban Kentucky Fried Chicken because they think it's poisoned. No, it's Kentucky Fried Chicken. It's not poisoned. It's like barbecue sauce, So there's a bit of hysteria going on right now that would benefit from a more reasoned approach to solving things. And then we finished up, Dorcy finished up by talking about case studies. There was a parental abduction case she worked on in Utah, the 2.5 years of no contact prior to her involvement, 10 years in the legal system with false allegations. So she described that situation and her recovery. Then she talked about the NCMA AC recovery, runaway parental abduction with false allegations, post-recovery clandestine contact. So she gave a case study of that situation. Then she gave a case study that she calls the anarchist, self-proclaimed trained killer. He was expelled from school because they feared violence, substantial substance abuse, false allegations, and he turned out to be a real sweetie that she just softened up to. Because they all are present so tough. And then these are references for mostly my talk on ABPA. So that is our talk on Dorcy Pruter's section of the AFCC High Road workshop. And then I have a separate seminar regarding my section that I talked about, the attachment-based model of parental alienation. So with that, I think we are at a stage now, or I'm at a stage now, where I have both that information up online now with these seminars from 2017, what I spoke to them about, putting them on notice about their obligations, introducing them to Ms. Pruter and the High Road workshop, that now I'm ready to follow up with the next seminar, which is about the AFCC's 2024 theme about protecting children, or issues of child safety and well-being, issues of child abuse, assessing for child abuse in the family courts. So with that, I'm going to end this video segment from 2017 and return back to 2024.